Rob back in the chair today. He is here to reinforce zone 3 and zone 4, the second half of the scalp. As some of our viewers might say he looks familiar, that's because he was here roughly around 2 years ago. We did zone 1 and zone 2 the first half, so almost all of this is transplanted for Rob. So what we want to do now is we want to match the crown to the front. And the goal is roughly around 1,500, 2,000, 2,200, anywhere from 2,000 to 2,200 would be a good number to restore zone 3 and zone 4. All right, let's have a piece of tape, Flor. Thank you. So what we're gonna do now, Rob, is we're going to shave the donor region, okay? All right, and then we'll shave the top later on. Look straight ahead a bit for me. So what we did for you, Rob, was we also did scalp micro-pigmentation, I believe, right?
Right.
To conceal your strip scar you had in the past, that
Right.
linear scar.
With that huge 20-year-old scar up there.
You can barely see your old scar anymore.
They concealed it beautifully.
It looks really, really awesome. Now, a lot of times we get clients or messages asking us to show the donor region and what it would look like after an FUE.
Yeah.
So what we'll do is we'll point the camera on your donor. Now, this is something that clients do want to see, is what the donor region looks like after it's been healed.
Absolutely. I was excited to be able to get that scar fixed. It was nice that not only could you do all the transplant work, but you could also correct that ugly scar from 20 years ago from the antiquated process we've done back then.
Show the donor. The strip scar looks really awesome. You can barely see it after the revision. All right.
Especially with a little bit of hair growing in, it looks perfect.
How many grafts did we give you the first time around?
2,764. And I had a ton of triples in there, remember?
Let's have a market, please. Yeah. Triples is what's really going to give you the density.
I don't remember the ratio, but we had like 60 or 80% triples last time. I think it was a kind of a large number. I remember you noted.
Good. The higher the percentages, more density. And this is where a lot of clients ask that they want a certain amount of density, and what we're basically able to achieve is all dependent on their donor region.
Honestly, the density was mind-blowing for me. Having done 2 procedures at a different doctor roughly 18 or 20 years ago, not using the FUE but using the antiquated process, I was never happy with the density back then, so I was absolutely astounded at the density that you were able to achieve up here.
Awesome.
I didn't think that was possible.
Now what we're gonna do is we're gonna try and match the back to the density you have in the front.
Beautiful.
So it looks nice and full. Alright. And your donor region is still pretty strong.
If I recall right, we pulled from this side before and you'd saved this side here for this one?
Yes.
Awesome.
We're gonna go far apart. Alright, Rob, you're gonna feel something cold. We're disinfecting the donor region.
Okay. I think you said you're part Lebanese, right, Jacques?
I am.
Have you been to Marouche ever on Santa Monica? The restaurant?
Marouche, did they have one in Santa Monica? They had one here in Pasadena.
Did they really? So is it the same guy, Serge?
I'm not sure the owner's name. There's Sahara and there's Carousel I go to.
Okay.
Alright. Let's have a try, guys. Bring your chin a bit to your chest. Alrighty. Let's have fresh gloves. Bring your chin a bit down to your chest. Alright. So what we did so far, Rob, is we disinfected
I know it's coming now.
the scalp. And now we're gonna have to numb the donor region, okay?
So I'm gonna get a couple shots first that'll to get it started.
Yes.
All
You're
right.
gonna feel a vibration device. That's going to distract the nerves. This is the worst part for this phase, okay?
Yeah.
Quick poke on the right temple and then the left. Here we go. Take a deep breath. Bring your chin a bit down to your chest. Here we go. 1, 2, 3.
Nice deep breath.
You're almost done. That's it. You did it. Good job.
Okay.
How bad was that?
Yeah. I don't like needles. That's all I've been thinking about all morning. Yeah.
All right. Here we go. Take a deep breath. 1, 2, 3. We're almost done. 3, 2, and 1. That's it. You did it. Right side is all done, Rob.
Have some juice.
Oh, thank you.
What we did on the right, we have to do the same on the left side. You're gonna feel a vibration. 1, 2, 3. Here we go. 1, 2, 3. You are on film, Rob, so we gotta look strong. I'm kidding. I'm joking.
I hear you.
Alright. Here comes the top portion. 1, 2, 3. Almost done. 3, 2, and 1. You did it. Good job. All done. How bad was that?
That's great.
You see how quick that goes by?
It was fast. I'm just exceptionally a big baby with needles. It's a lifelong thing, you know.
It's okay.
I was telling Flora my nightmare session with my doctor at 5 years old and how I never forgot it.
You're awesome. So what we're gonna do now is we're gonna start the harvesting. We're gonna target
Okay.
the number of grafts. I
Can
think
get those out.
2,000 and 2,200 is a good number. All
That's great.
set. We're gonna get you in position. Any pain, Rob?
No.
No. Okay, I'm numbing this next area, okay?
Uh-huh.
Any pain here?
No.
Good. Beautiful. That was the reason why we did the nerve block earlier this morning.
Gotcha.
So
I had
you
a
don't-
feeling you were grabbing a needle a minute ago.
Good. Yeah, it should be pain-free. All right, Rob. We're almost done, okay? We're finishing harvesting.
Great. Great. It's been fast. Easy.
Good. How bad was this phase?
Not at all. The numbing up a little pain, but other than that, it's been cakewalk. Yeah, it was actually surprised that you're already done with this part.
They're coming out easily.
Perfect. Think we got a bunch more threes?
So far, every single one of them are
Good.
multiples.
Good.
This one has a 5.
Cool.
This one has a 4. All right, Rob, we just finished the harvesting phase. How did that go for you?
Smooth, easy.
Everything was good?
Yep, very
Alright.
easy, very easy.
What was the worst part, the injections?
Honestly, the whole process, I can tell you from the first procedure, and this as well, it's just the injections for the anesthesia. Those are a little bit painful, but everything from there smooth sailing.
Awesome.
No pain during the procedure, and with my prior procedure, I had no pain when I went home. I barely used some ibuprofen is all I needed, and let everything do its thing.
So what we're gonna do now, Rob, is we're going to break down the zones and we're gonna
Okay.
work on the crown, okay? This
Excellent.
actually is our first crown video.
Oh wow,
Yeah, I always get messages, hey Jacques, when are you gonna do the crown? Why do you
Cool.
only do the front? Well, because the front involves a lot more artistry. The back is very straightforward. The only thing we have to do is follow the natural world that a client has. Not everyone has the worlds, but you have a very select one. So what I'm gonna do now is I'm going to break down the zones.
okay.
Alright.
Well, the back looked good till you gave me all this hair up front, and with all this hair up there, now it looks like nothing back
We
there.
have to balance it out.
There you go.
Turn slightly this way. First 2 centimeters is zone 1. We're not touching the design or the hairline. Look down a bit for me. Following 5. Zone 2. We're not going in this area, as we already have. Now we're going to go into zone 3, which is the one after zone 2. It's following 5. And anything left after this falls into under the crown. Let me have a fresh marker, please. Thank you very much. Alright, so this is zone 3. Your zone 3 is actually not bad. Just the small areas that we could reinforce in the center. Most of the work is going to go in your crown. Look up towards the ceiling a bit for me.
Is this considered zone 3 back here, or is this
That's zone 4.
So that seems like I'm really hurting.
Look up towards the ceiling for me. Let's divide by left and the right side. Let me have another marker, please. You have one whirl that goes like that. And that's what we're gonna do, is follow your natural pattern. Everything else is pretty straightforward, okay?
Great.
Awesome. So we broke down your zones, Rob.
Okay.
Okay. And now, floor. Did we tell you the number of grafts we received?
No,
No?
no.
Floor
So
was
we
the
have
most.
2,259 grafts.
So
Wow.
we were aiming, we said anywhere from 1,500, 2,000 to 2,200. So we actually got a little bit over 2,200.
Beautiful. That's gonna be dense.
2,259?
Yes.
2,250.
Beautiful. Hopefully we got a bunch of 3 here.
Let's find out. What are the percentages?
For singles, we have 509 grafts at 22%. For doubles, we have 1,026. And for triples, we have 729.
What are the percentages?
22% for singles, 46% for doubles, and 32% for
Okay.
triples.
So this time you have more doubles
Okay.
than triples. Last time you had more triples, I believe.
Yeah, yeah.
Why is that? Anytime a client does more than one procedure, the yield drops with the
Gotcha,
triples.
makes sense.
The first procedure is always going to give the highest number of density. Second, we're working with leftover grafts, whatever's left on the donor, and the more we do it, the percentage of the
The
triples
quality
drop.
starts, gotcha.
Exactly.
But we really needed those 3 strip here to
Exactly.
give that.
And this
that-
is your third procedure today. You've had one strip, you've had a prior.
2 strips.
Oh, 2 strips.
This
So
is my 4th.
This will be your
Yeah,
4th.
yeah.
Okay. All right. So that being the case, having 4 procedures, the percentages are pretty good because you still
Excellent.
have almost 80%, 78% doubles and triples combined.
Good, excellent,
For a 4th
excellent,
procedure, that's not bad.
excellent.
Okay. Now, question. Do you want me to shave the entire scalp or just the areas that we are
Do
working
you have a
on?
mirror I can look at it for a moment and figure out
Sure.
what we're doing? Yeah.
My recommendation for you,
Yes,
since we have no business going in the front,
okay,
keep it the way it is.
okay, and just do the back?
Just we'll clip the back.
Okay,
It is going to look a little weird for the first 7 to 10 days.
sure,
Because the donor's super shaved,
right,
everything else is long on top. What you can do, once the donor heals and the hairs start to grow, you can actually blend what you have into one.
gotcha, so
versus
faded upward.
Faded. Versus having to wait 4 or 5 months to get the look you have right
Okay.
now. Give it about 7 to 10 days. See our stylist, and he could blend it in for you.
Beautiful,
In
beautiful.
that case, all we have to do is clip the
We don't
zone
go with the
4.
monk look then, huh? Okay,
All right, let's have the clippers and the chuck. We're gonna shave. We decided to just clip the back and keep the front long.
yeah, I think that's a good idea,
Okay.
I think that'll work best.
Sounds good. Here we go.
Excellent.
I've already outlined the area
Okay,
that's thin. Like I mentioned, it is going to look a little weird for the first few days, okay?
No
About
problem.
10 days.
after going through 2 decades of looking at the mirror, in the mirror with my hair thinning and worrying about it, anything else is an improvement. It's all uphill from there, you know?
Let's have a Clorox. We're gonna disinfect it next. Thank you.
Yeah, I can tell you wholeheartedly, everything I've been through during the procedures has been cakewalk. It's been absolutely nothing compared to spending years and years and years of looking in that mirror, you know? And watching your hair go and go and go.
We have one more Clorox. Thank you. So this next phase actually shouldn't be as painful, okay?
Great.
Most of the scalp is numb because of the donor. Okay, since we are working in the back, it just allows this to go numb versus the front, we actually have to numb
Sure.
with the eyebrows. We don't have to since we are working in the crown.
Considering the amount of work that we did in the first procedure, I did 2,700, I was actually surprised I didn't have any pain afterward. I really, truly didn't. I mean,
Awesome.
to even say minor discomfort might have been an overstatement. I took some ibuprofen to deal swelling, and it really wasn't a big deal. I mean, I've truly gone to the dentist for far less and come home
We have
in more pain.
Another marker. All right. So this is where the whirl is on the right side, and what we're gonna do is we're gonna follow your natural pattern.
Great.
Okay, and I'm happy you decided not to shave the entire head. Give it within a few days, everything should blend in.
Beautiful.
Awesome.
I have a cowlick on the front of my hair. You did a beautiful job with my first procedure making this blend in.
That's awesome. All right, Rob, we're gonna numb
Okay.
the recipient site now. like I said, most of this should be numb, okay?
Right.
No eyebrows this time. Here we go. How bad is this?
I'm not feeling it yet.
Good.
Hoping it'll stay that way. Yeah, I'm not feeling anything.
Might start to get sensitive here. Any pain?
Very minimal. Ow, yeah. Spoke too soon.
Beautiful.
Really nothing though, minor. I think it was more the anticipation of it.
Got it. Now this one will sting. We're gonna go right at the very tip. There we go. Apologies in advance. 1, 2, 3. Almost done. You're doing great. This is the worst part.
Ow.
You feel the vibrators helping a bit?
Yeah, definitely. I think it's just me mentally being aware. You know what I mean?
It's okay. Who likes getting needles stuck in their head?
Nah, like I told you, I'm the biggest baby on the planet with them.
Alright. Most of this should go numb. Or
Perfect.
should be numb.
Yeah, I feel it numbing up, definitely.
Good. Any pain?
No.
Good. You're doing awesome, Rob.
Thank you.
All done.
Perfect.
You are all set. No more
Perfect.
injections for the whole day.
Excellent.
All right, Rob. We just finished the numbing. How
Okay.
bad was that?
Not too bad. Little,
Not too
you know,
bad.
needles never feel fun, but not too bad at all.
This should be completely numb.
It is.
What we're gonna do now is we're gonna work on the incision part, okay?
Beautiful.
You're already more than halfway done today.
Awesome.
We've done the harvesting. You don't really have so much design, but we did break down the zones.
Okay.
Third is the incisions. After incisions, we're gonna have lunch. Thank you,
Okay.
by the way, for lunch.
No
I heard
worries.
you got lunch for the office. Is that true?
Yeah, you guys took great care of me last time. So
That's awesome. Thank you.
Gave
You
me a
didn't have
beautiful
to.
head of hair and a wonderful lunch. So who
Thank
can
you so
complain?
much, Rob. And then once we're done with the incisions, which should take us about 45 minutes to
Okay.
an hour, we're gonna break for lunch.
Excellent.
You come back from lunch. We finish today with the implantation.
Beautiful.
Sounds
like
good?
sounds like a deal.
I'm gonna get sterile and we're gonna get started.
Thank you.
Any pain, Rob?
Not at all.
Beautiful. Are we doing PRP for you?
I don't know. Have we done that before?
I have to check your file. But PRP is beneficial. Do you want me to?
That would be great. I would love to.
All right.
Anything that's going to make this flourish and look even better is awesome.
Perfect. So what we'll do is we'll also do PRP for you as well for the crown.
Beautiful. Thank you.
That's gonna help you with recovery, sooner growth, higher survival rate, okay?
Beautiful. You know what's really nice is the hair that's been transplanted up there is that thick, just really vital hair from the back. So all the hair that's been put on top, the transplanted hair, the grafts, looks just healthy and gorgeous. I mean, it's full, it's shiny. You know, it looks like really youthful. You know, it looks like a much younger person hair than I have. Yeah, that I am. You know.
Well, that's your donor region. Everyone gets a different quality. That's why every client's outcome is different. Not every two is gonna be the same.
It's just been really pleasant. I mean, I get out of the shower, I, hand toss my hair, put a little bit of the minoxidil spray in there, and my hairstyle lays beautifully all day.
Beautiful. Any pain?
No, not at all.
Beautiful.
See, to me, this is where the real artistry is. This is where the angles where you're placing them at, the density, that's so critical. I mean, that's why my hair looks gorgeous in front.
All right, Rob, we're almost done. We only have 50 more incisions to make.
Excellent.
Meanwhile, Flora's gonna draw some of your blood for PRP, okay?
Wonderful.
Platelet-rich plasma. It's gonna help you after the transplant with recovery. It's gonna help you see sooner growth and higher survival rate of the grafts as well.
Beautiful.
So you're not gonna feel a thing. She's gonna pull the blood from the line that you have.
Perfect.
A few more minutes and we're all set.
Will it make me younger and taller?
You never know.
Huh.
So you may feel something a little cold. It's just saline. Extend your arm out for me. Just like that.
Perfect.
Thank you. Beautiful. Just like that.
Great.
Feeling okay?
Oh yeah, I don't feel a thing, honestly.
Perfect.
Don't feel a thing. It's been very smooth today.
Very good. So we're going to take about 35 cc's of your whole blood today, okay?
Okay.
We have a nice lunch waiting for you.
Beautiful.
And
Now you guys just served me a wonderful meal here.
after this is done, we'll go ahead and spin it to separate the platelets.
How long does that take?
Approximately 16 minutes. Spins in 2 cycles. So you can get your growth factors. Doing okay?
Absolutely.
We're almost done, okay?
Yeah, no worries. I'm doing great.
And we followed your natural pattern as well, Rob, okay?
Beautiful. That's tricky. I've got a couple of calyx up there. It's going to take some definite artwork.
Mm-hmm.
Now you did
You
a
have a
beautiful.
big one on the right and you have a smaller one on the left.
And I have one on my front, my hairline in front that you did just wonderfully with. I was worried it was going to stick up and do weird things, and it parts beautifully and just lays nicely.
Awesome. We take our time.
Everything's been a class act here.
All right, you are all set.
Wonderful.
The incisions, PRP's done as well. Nice.
Yes, sir.
Let's clean you up a bit. All right, the PRP just finished spinning. So what we're gonna do now is separate. There you go. This is a PRP. Platelet poor plasma and the platelet rich. The growth factors are heavier, so they sink in the bottom. This is the part that we're really going to need. And this is going to help Rob with recovery, sooner growth. As soon as we see bubbles, we have to remove the syringe. So there you go. And now we're going to mix very slowly. This is going to help Rob with higher survival rate of his grafts, sooner growth, quicker recovery. This is the body's natural way of healing itself. We just have 5 to 7 times the concentration. All right, that's it. This goes here. All right, Rob, you haven't seen the recipient side, have you?
Not yet, I haven't.
You want to
no.
see it?
That would be great.
All right, so let's hand you a mirror.
Great.
And this is,
Wow.
do you see the reflection?
I do. Wow. Wow, that's a big area.
So we covered partial 3 and all of 4 for you.
Beautiful.
Okay.
Beautiful. Wow. I knew it was going. Thank you.
And now what we're going to do is the PRP.
That used to be my area with the most hair until you gave me all that hair in the front.
I know. You actually had a lot of comments on your first video about, does it look like his back is spinning?
Yeah.
And I said that because the front got so dense that it kind of went out of balance.
Honestly,
Now we have to match the back to the front.
it's 5 times more density I thought it'd have. I
Good.
didn't think this type of density could be achieved.
All right. It all depends on the patient's donor. All right, drop your head back. Backwards.
Sorry.
All right, we're gonna do the PRP. You should not feel a thing, okay?
Okay.
Any pain?
Not at all.
Good. This is gonna help you with shock loss as well.
Great.
So this minimizes shock loss if you were to get any.
So I understand it separates the platelets. How does it work exactly? How does that affect the body or help it?
The specific PRP kit that we use has different chambers.
Okay.
So it separates the platelet pore and it runs at a certain speed where the platelet pore, or they rise, and the platelet-rich, they fall in the bottom because they are heavier.
Okay.
And then we separate the two with a cannula. And the ones that settle at the very bottom are the ones we harvest and we inject. And this is what helps your body heal anytime you're injured. God forbid you fall down.
Gotcha. Now,
We
why does
just
the
have 5 to 7 times the concentration. Thank you.
so
that
why does the
typically
body
does.
respond so well to the rich platelets?
It's your natural way the body heals.
Interesting. Interesting. Fascinating.
So we've harvested 5 to 7 times compared to the baseline.
Wow. And this is a relatively new technology, right? This wasn't available years ago when I first.
7 years it's been since I've been incorporating it with
Nice.
hair restoration. You are all set, my friend.
Beautiful.
We're
Thank you.
gonna start the implanting next. A few more hours and you are all done, okay?
Wonderful. Thank you.
All right, we just finished the PRP. What we're gonna do now is the distribution of the grafts. If you could read off the numbers for me.
Sure. We have singles, 509. We have 1,026 doubles and 729 triples.
Okay. If I can, please have another marker. All right. So what we're gonna do is we're gonna place all the triples here, followed by the doubles, twos, and ones, all outside. And the whirl we could have in the center, just a few singles, followed by the triples around it. Okay? That's it. You got
I
it.
was standing around maybe 30 kids. And I just yelled out to all of them that we have to get away from here. So we're going to run down to the beach and we're going to swim for land.
Breivik will have known that safety advice for anyone swimming in the cold waters of a Norwegian fjord included wearing a wetsuit at all times,
Yeah.
and never going beyond 10 meters from shore. Cramp can set in so quickly that being able to return to the shoreline promptly is vital. The youngsters with Christopher now faced a journey of around 200 meters without wetsuits.
So I yelled out to everybody that they should take their clothes off and get into the water and start swimming.
I think he very much wanted to create chaos and terror. This was something that wasn't a knee-jerk reaction. He'd thought about this for a very long time. He knew that this would cause almost chaos. The very location of this island you can't get to by car, which means it would have given him the longest amount of time. This wasn't something that police could just run and come to. These children were like sitting ducks. There was nothing they could do.
The water was cold and it was rainy and windy and everybody was panicking. Some were getting cramps already. We weren't even halfway over. I figured that.
All right, Rob, We did it. You finished.
We're here.
You're here. Have you had a chance to see it?
I
yet?
have not. I'm excited. Let's
You
do
have not?
this.
Okay. I really love the hairstyle you're sporting right now.
I gotta see it first.
Let me give you the mirror. Here you go. I'm gonna get you a double mirror. So you get to see.
Wow. Can you angle
Are you
up a
able
little?
to see
There you
that?
go. Perfect. Wow.
So all of that
Jeez
is
Louise.
covered.
Wow.
Almost 2,300 grafts, okay?
Wow. So almost as much as I did in front. I'm gonna be one hairy guy. This is great.
You're gonna have a lot more hair
Beautiful,
than you
guys.
had
Beautiful.
when you were 18. By the way, Rob, guess what I found?
What's that? Oh, my original photo. Oh my
Your
God.
original photo before
Night
you
and
had
day.
your procedure in the front.
Night and day. You filled all of this.
All of this?
in, and now here.
Parts of 3, and now we did all of that.
Wow. Wow. That's not even the same guy.
It's not even the same guy.
I'll tell you guys a quick story. My nephew ran into a guy in Long Beach the other day. We live about an hour apart. And he said, "Uncle, I thought it was you. I thought it was you, but then I remembered you have hair now." And the guy didn't. I guess the guy was a dead ringer for me, but he didn't have the hair.
I see.
So
I'm glad that's how he's distinguishing you.
everybody loves the work you've done. I mean, obviously it's a tape; it's hard to see, but
Awesome.
what you've done with my hair here, and I know what's going on back
And
here.
Hopefully the back will match the front.
It's gonna
now.
be amazing.
It's gonna look amazing.
Yeah.
You did awesome, Rob.
Thank you.
We
Hey,
finally got to do a crown case for the
I
video.
can't thank you guys.